Polycystic ovary syndrome is a condition that affects the ovary. Many people who have ovarian cysts will have this condition. And there are three major signs that may confirm to us that you have polycystic ovary. One is that there is an ultrasound evidence that you have a lot of eggs surrounding your ovary, but those eggs are not available. Number two is that your menses is skipping. You may have one menses, 2 months you don't have it again, and then it comes back again. And the third one is that you have excessive androgen in your body. So you may start to have effect of that excessive androgen as excessive hair. Some of the ladies you see, they have beard. Some of them will have mustache like me. Some of them will have very heavy hair growth on the chest, on the legs, and all that. So when you have the constellation of these three things, what you have is a polycystic ovary. But there are other things that are also associated with polycystic ovary, and these are what we call signs and symptoms of polycystic ovary. And number one is that your menses may not be regular. Now, when we say menses is not regular, number one thing is that your menses may be very few in a year. You may have 6 to 8 number of menses in a year, or even lesser than that. That's one thing about menses. And when you then eventually have your menses, it might probably come very heavy. And when it is heavy, it can even get longer than your usual period of time. That's a polycystic ovary. Okay? Number two symptom is that there could be a kind of delay to conceive. So when you already have polycystic ovary, you are not just trying at home thinking that one day you are going to become pregnant. It can happen, but the chance is very low. You need to have intervention of some skillful manipulation of your hormones so that you will be able to ovulate at the right time and then conceive at the right time. There are drugs that can help us to achieve this. Many of you have abused some of these drugs, but we need to make sure that we juggle them back into right proportion, and then you will see that you start to ovulate and you can become pregnant and become a mother. All right, and I'm sure that's your desire. Okay, now some other people have problem with the excessive hair. It's making them to look hot. Everybody is asking them, oh, what is happening? Are you taking some injections? Are you trying to become somebody you are not? So you know all those things now. Especially a lady that is very clean skin before and then start to have excessive hair. Somebody would think maybe they are trying to convert to something, maybe they are going to do transgender things and all that. So it may be worrisome. There are drugs that can also control those symptoms. All right. Now there are some associated symptoms that come along with polycystic ovary. One of it is that your ovary is big, so you may be having occasional abdominal pain. In fact, why some people will know that they have polycystic ovary is that sometimes they have abdominal pain and they went for ultrasound and they discovered that the ovary is very big. That ovary is not meant to be removed. It's not a disease that entails removing that ovary. There are many things we can do on that ovary to improve it, but not to remove it. And the cysts there, even though they are numerous, they are not to be removed. There are drugs that can be given that will make those eggs to be available for fertilization. All right, these are things that your gynecologist can do. Now, beyond this, you will see that most of them can also come with excessive weight. So the body mass index may be bigger than expected. You may see that they are huger, usually more than 100 and above. It could also be as a result of this polycystic ovary. It also comes with some metabolic disorders, like you see that you have dyslipidemia, your cholesterol is not balanced, you have too much fat in your system, or you will start to have features of hypertension gradually creeping in, or you can even have outright diabetes mellitus. All of these things work together when you have polycystic ovarian syndrome. Okay, now beyond the time of birth, when you have given birth, you still need to be followed up for a very long time, because sometimes this effect still continues. The reason why you are not bothered is that you are not looking for baby. but it doesn't mean that the effect is already expired. No. So this thing continues with you, and therefore you need to be followed up. We need to be looking at the lining of your womb as you grow to be sure that it is still in the right proportion, because that is how some cancer can set in. For people who have polycystic ovary syndrome, they should not just say, oh, I am okay now, I am okay. No, they still continue to monitor their womb with uterine ultrasound and many other things that we can do. We can do endometrial sampling and all that to see what is going on there. Some of them, when they are already sure that they are done with pregnancy, we want to give them something called Mirena to make sure that the internal milieu of their uterus is well controlled. If you have all this controlled, I can tell you will live relatively good life, no other challenges in the future. There are many other things that also coexist with this disease, but once you attend to these chief symptoms, you will be fine. So I can tell you once again that you are fertile. You only need to see a gynecologist to help you to tweak your hormone to what exactly your desires are. Now, when you have all the symptoms I described, the one that bothers you is what your doctor will treat. So invariably, there is no cure for this disease. So what we do is that we just manage that particular symptoms. You want to have baby, we start to manage it so that you have baby. Oh, you're having pain, we manage you so that the pain will go. Oh, you're having excessive hair, we give you different things that can prevent excessive hair. Oh, you're not seeing your menses, we can give you pills and drugs and injections that control your menses, and that's essentially what gynecologists will do about you. All right, I hope this helps. Thank you very much.